Mohan Selvam, Chairman and Managing Director of KONCEPT Hospitals. KONCEPT Hospitals was established in the year 2013 for the purpose of creating awareness in the people about least pharmaceutical intervention therapies. It is a hospital which is propagating integrated wellness. Integrated wellness is a combination of different modalities of treatment to achieve a complete cure. If you take any disease for that matter, there are some diseases which can be easily cured with medications, some of them which are becoming chronic because we cannot address them fully. To avoid all these things, what we have done is we are integrating different modalities of treatment to bring in a complete cure. Like for example, we want to reach a destination, let's say for a foreign country, you have to go to the airport by a car and then to take a flight to reach the destination. Similarly, we use different modalities for different diseases to reach a complete cure. That is what is called as an integration of different modalities, and we call this as an integrated medical system. And we also focus on preventive health care. Basically, many of the diseases are preventable in early stages. People are not aware of this preventive health care, so we are creating awareness in the preventive health care. This cardiology free camp is basically a preventive cardiology concept. In India, if you consider the major killer, cardiological diseases, heart related diseases are the major killers. Next to that comes cancer and many other diseases like that. So we want to create awareness in the people. Nowadays, if you look at the television, you look at the papers, you can see a lot of people younger in age group, between the age group of 20, 25, even in the school age group, there are people who are succumbing to the heart diseases. So how is this happening? Usually we think that the heart disease is because of the old age, but nowadays that myth is broken and even young people can get heart diseases. So we wanted to create awareness in the people, so we have devised this free camp wherein we are going to screen the people for some basic investigation procedures like arterial stiffness index analysis, which is one of the most powerful tool which can identify the circulatory status of a patient. With this, which is a very non-invasive few minutes test, we can identify whether the patient has got any arterial stiffness, any blocks in anywhere in the body. No matter whether it's the heart or any other part of the body, it's going to have a major impact on the end organ. So by identifying this, we will be able to tell the people and create awareness that they are into for a major complication. It is always better to prevent the disease rather than to succumb to the disease, then get it treated and then come out of it. So we try to identify the problems before they manifest as a symptom in the patient themselves and give them the idea that they are in for a major catastrophic event. So by doing this test and by creating awareness, we are able to achieve probably a couple of decades of healthy life to the patients. The main idea is to give them least pharmaceutical with maximum awareness, and preventive health care is the basis of this camp. KONCEPT Hospital is established for the same purpose. We do different modalities of treatment like quantum biofeedback, ozone therapy, EECP, which is called as external enhanced counterpulsation, which is a circulatory therapy. We do chelation, we do intravenous nutrition therapy, we do acupuncture, and we do a lot of other modalities which can help the people get through the disease without any medication or with the least medications. That is the main purpose, because everyone is scared of medication nowadays because of the side effects, so-called side effects, and complications arising out of it. But in this system, we use minimal amount of pharmaceuticals or medicines, and we give maximum natural methods of treatment as well as nutrition, so that the patient gets better without medication, or at least with the least medication. That is the main purpose of our hospital. And though I am a medical doctor, I am also specialized in various other systems, getting certified in different countries, and I am trying to bring in all these knowledges and give people side effect free, very comfortable, easy to take in treatment modalities, and get them completely cured of most of the diseases, including major catastrophic diseases like heart diseases, cancer, diabetes, and all these diseases. So this hospital's main purpose is to give them a good service good, comfortable, side effect free treatment modalities to reach their complete health.
So how can we find heart disease in the initial stage and how it will cure?
No, heart disease initial stages, because many of the people when they develop a symptom, you go to a investigation, let's say for a angiogram. The doctors say that they have 90% block, 70% block. How this 90%, 70% can happen in short time? It is not possible. It has been there for a couple of years, but it was asymptomatic because the body goes into what is called as adaptation mode and tries to adapt and give maximum comfort to the person. But at one stage, when it is going beyond certain level, it cannot sustain anymore, it starts showing symptoms. But when you do the investigation, then it lands up as though you are in a serious disease. In this method, using our arterial stiffness index, we have a special machine which is an FDA approved machine, which is just using a simple finger clip and which can be done in a couple of minutes. We can identify whether the patient has got this artery which is stiff, which can predispose to a major catastrophic event like heart attack or angina or major diseases like stroke, kidney failure, because whenever there is a block in any of the arteries that goes to the organ, it creates an damage to the end organ. So by identifying this, and when we know that the patient is going in for that, we can help them to prevent the diseases by suggesting some medicines or natural methods, or we do something called as ECP therapy or chelation therapy or nutrition therapy to soften the arteries, to open up the blockages and prevent the diseases.
So how common man can find out this?
That is the biggest problem. The common man cannot find out this because they don't have symptom. Only when you have a symptom, you go to a doctor. If you don't have a symptom, you don't go to a doctor. When you don't go to a doctor, the problem gets into the system. Now there are new methodologies with which we can find out a little earlier. For example, cancer is such a difficult disease to cure, right? It is very difficult unless otherwise you diagnose it in the early stage. Most of the people come to know about cancer only in the stage 3 and stage 4. We have a lot of good investigation of late coming out, like circulating tumor cells, circulating stem cell investigations. These can identify cancer even 3 to 5 years before they symptomatically show up. Similarly, the cardiac diseases, by checking up the arterial stiffness index and the blockage index, will be able to tell the patient they are going in for this and tell them to change their lifestyle, prevent them. And also, in cases like most of the chronic disease, if you look at 80% of the disease is stress related. If you don't identify the stress and tell them what it is, they are going for a disease, right? So what we do is we do analysis called as quantum biofeedback, which can give us an idea about what type of stress it is and what type of problem they are going in for that, and tell the people you are in for this and change your lifestyle and change your diet and take this medication so that you don't fall sick or don't go into a major event, catastrophic event. That's it.